Well, good evening, everyone. My name is Jacob Williams. I am a pharmacist and owner of All People's Pharmacy. And I want to welcome everyone. Thank you for being with us. I want to welcome and thank you for joining us tonight for our first Health and Wellness Town Hall presented by the Jacksonville Alumni Chapter of Kappa Alpha Psi Fraternity Incorporated. Welcome to all of my brothers of Kappa Alpha Psi that are here on the call tonight, and welcome to all of our Divine Nine sisters and brothers that are on the call as well. At this time, I'd like to recognize the 41st poll mark of the Jacksonville Alumni Chapter, Julius L. Collins. I would also like to recognize the members of our Health and Wellness Committee, Dr. Frank S. Emanuel, Dr. William Cody, Dr. Wesley Mills, Dr. Herman Miller, Dr. Darrell Watkins, Frank C. Emanuel, Senior Vice Poll Mark, and myself, Committee Chair. At this time, I would ask Senior Vice Poll Frank C. Emanuel to do some quick housekeeping rules, and then I will introduce the panelists for this evening and turn it over to Dr. Cody to get us started.
Good evening. Thank you, Brother Chairman. Good evening, all. Thank you for joining us tonight. Quick housekeeping, just want to let everyone know that at this time, all participants will be muted unless you are a part of the panel. Also, please be mindful, if you did not submit a question prior or during the registration process, the chat feature is available. So you can submit your questions in the chat during the presentation. Also, there's a feature where you can raise your hand. So when we are ready to take questions, we'll recognize you when we see the icon that your hand is raised, and we'll kind of just we'll let Dr. Williams know that you need to be recognized. Also, this town hall will be recorded, and this recording can be accessed on our website at jacksonvillecappas.com. Thank you.
Great, thank you for the Senior Vice Poll Mark. Okay, I want to introduce the panelists, and I am so excited to introduce these colleagues of mine, and I think you guys are gonna really have a treat tonight. They have a lot of great information to share, and looking forward to it. So first, I want to introduce Dr. Kelly Wells. She's an MD, family physician with a background in public health, who serves as Florida Blue's Senior Medical Director for Medical Affairs. In this role, Dr. Tice Wells oversees the company's health equity strategy and has responsibilities in the areas of corporate social responsibility, public health, surveillance, and addressing the social determinants of health. She currently serves as the clinical lead for Florida Blue's COVID-19 response. She's a graduate of Florida A&M University and the University of Florida College of Medicine. Before joining Florida Blue in 2018, she spent 17 years as a public health physician, serving in numerous leadership roles, including that of County Health Officer, State Medical Director for Florida Department of Health, and Chair of the state's Health Equity Program Council. Throughout her career, Dr. Wells has focused on developing strategies to motivate and support healthy behavior change in patients experiencing desperate impacts of chronic disease. Dr. Wells is a member of the National Medical Association, the Northeast Florida Medical Society, the American Academy of Family Physicians, and the Florida Academy of Family Physicians. She currently serves as the chair of the Dean's Council, Brooks College of Health at the University of North Florida. She is the mother of 4 children and a proud member of Delta Sigma Theta Incorporated. She's passionate about addressing health disparities and considers community engagement critical to identifying and deploying solutions. Next, we have Dr. Wesley Mills. Dr. Mills is a board certified primary care and sports medicine physician. Is located on south side of area of Jacksonville off Gate Parkway near St. Vincent's Medical Center, South Side. He's a graduate of the University of Missouri Columbia School of Medicine. Dr. Mills completed his specialty training in family medicine at St. Vincent's Medical Center, Jacksonville, Florida, where he was chief resident. He completed his subspecialty training in sports medicine at Mayo Clinic in Jacksonville. Dr. Mills is an active member of the Duval County Medical Society, Jacksonville Sports Medicine Program, Northeast Florida Medical Society, American Academy of Family Practice, American Medical Society for Sports Medicine, American College of Sports Medicine, and American Medical Association. He has served as the team physician for the Jacksonville Barracuda semi-pro hockey team here in Jacksonville and Inglewood High School football team. Most recently, he was named primary care medical director for St. Vincent's Medical Group and is an adjunct instructor in family medicine at Mayo Clinic in Jacksonville. In addition, he is a member of Kappa Psi Fraternity Incorporated and an active member of Bethel Baptist Institutional Church. In December 2008, he opened Mills Primary Care and Sports Medicine, PA, a division of St. Vincent's Primary Care, part of the St. Vincent's Healthcare System. The office is located at 8075 Gate Parkway West, Suite 202 in Jacksonville. His scope of practice encompasses the treatment and evaluation of all primary care issues and those of a sports medicine and musculoskeletal nature. Welcome. Next is Dr. Jocelyn Spates. She is a full professor and associate dean of clinical affairs at Florida A&M University College of Pharmacy and Pharmaceutical Sciences, Institute of Public Health. She received her Bachelor of Science degree in pharmacy from Florida A&M University and Doctor of Pharmacy from Idaho State University. She has been a member, of the faculty of Florida A&M University College of Pharmacy and Pharmaceutical Sciences for 17 years. Previously, she served as associate professor of pharmacy practice at Jacksonville Instructional Site, where her duties included providing expertise and guidance in the educational processes of students, supervising a clinical practice site that involved monitoring, evaluation, instruction, and consultative services related to drug therapy and outcomes for general medicine patients. Dr. Spates is a board certified pharmacotherapy specialist and an American Association of College of Pharmacy academic leadership fellow. She has published numerous articles and presented posters at national pharmacy meetings. And she's also a life member of Alpha Kappa Alpha Sorority Incorporated. Welcome. Last but not least, our very own Dr. William Cody. He received his medical degree from the University of Tennessee College of Medicine. Dr. Cody completed his internship and residency in obstetrics and gynecology at Portsmouth Naval Hospital in Portsmouth, Virginia. Dr. Cody is board certified in obstetric and gynecology. He is a diplomat of the American Board of Obstetric and Gynecology. He served as the department head of obstetric and gynecology at the U.S. Naval Hospital in Okinawa, Japan. Dr. Cody also served as a department head of obstetric and gynecology at the U.S. Naval Hospital, Jacksonville, Florida from 1990 to 91. Dr. Cody was in private practice in Jacksonville for 30 years. He also held the position of associate faculty in OBGYN division of the St. Vincent's Family Medicine Residency Program. Dr. William Cody is a life member of Kappa Psi Fraternity Incorporated. He's a former Polmark of our chapter. Welcome, panelists. Thank you so much.
Thank you.
Now, Dr. Cody, would you please start your presentation?
I certainly can. I will go ahead and get this set to go. Here. All right, so you can see that okay?
Yes.
Perfect, perfect. And so for the audience, this is not going to be some long, lengthy lecture, but we as a panelist agreed to do just a basic overview of the coronavirus. And then we're going to open up and address questions, some of which we've already received. So just think of this right now as a coronavirus update and not some type of boring lecture that we're going to give to you. Most of us recognize this as the fingerprint of the SARS virus. And the SARS virus is what causes the COVID-19 infection. And most immunologists and virologists would recognize this, and just think of it as a fingerprint for the virus. We know that the virus has moved from animals. The bat theory certainly is one. Intermediate, so this animal that you see in the center here, pangolin, there's debate as to whether or not this is truly the intermediate host for this particular virus, but we know that in some place there is an animal that acted as an intermediate host. But the problem is this massive groupings of us as humans, where we are now transmitting the virus between each other, and that has to be the issue that we'll have to address and solve. So SARS is not new to us, and those infectious disease individuals and virologists recall what we dealt with in 2002. And people like Dr. Fauci, who's made international news, gave us some idea of what we as a society would be dealing with. And so if you look at 2012, the same type issue happened in the Middle East, where the intermediate host was clearly identified as the camel. So Middle Eastern Respiratory Syndrome of 2012, and then the Severe Acute Respiratory Syndrome of 2002. And the problem, it creates difficulty breathing for a number of patients that have been hospitalized. Origin of the pandemic. I think everyone now is pretty much in agreement as this having arrived from Wuhan, China. The question becomes, was it done deliberately? The intelligence service in the United States does not think it was done deliberately. Most people believe that it was an accidental release of this bat-related type virus that came out of Wuhan. And for those of you who may not be aware, Wuhan is a major academic and research center for the country of China. And this may be one of the busiest slides I have, so just bear with me, but this is very important information for you. So the COVID-19 is the infectious disease caused by a newly discovered coronavirus. Coronaviruses have been with us for quite some time. This COVID-19 by the name was discovered in 2019. It was actually discovered by a Chinese research physician in early 2019. He warned his colleagues about the seriousness of this disease, and unfortunately, he was found dead several weeks later. So I'll leave it up to you to figure out what happened to this unfortunate. He was 33 years of age and a brilliant physician, but is no longer with us. Most people, and we all know this, most people who fall sick with COVID-19 will experience a mild to moderate symptoms and recover without treatment. And therein lies the problem, because we have people walking around with minimal symptoms who are spreading the virus to others who are very susceptible to it. The initial 3 symptoms was cough, fever, shortness of breath. And the shortness of breath is usually what resulted in the hospitalizations. In the midsummer of 2020, we saw chills, muscle pain, headaches, sore throat, but 2 classic findings were noted: loss of taste and or smell, and then younger individuals were beginning to have a higher incidence of strokes. How does it spread? This virus that causes the COVID-19 is mainly transmitted through these droplets. And by looking at this picture here, you can see how and why a mask could certainly make a difference. These droplets are too heavy to hang into the air. They fall to surfaces. Our hands make contact with those. We touch our mouths, our face, and the rest is becomes a problem. This gentleman, can you imagine being at Publix and this guy walks in front of you, he opens the door, he gets a cart, and then you walk right in behind him and you touch these same counters. I mean, so again, masking does make a difference. Social distancing has made a difference. Symptoms, people with COVID-19 generally develop signs and symptoms, including mild respiratory symptoms, and they may not think very much of it. On the average, 5 to 6 days after exposure, but the range can be from 1 to 14 days, which is why we recommend that people quarantine for 14 days. Some literature is now saying that the quarantine period can be 10 days, but I'll let my very smart colleagues, Dr. Wesley Mills and Dr. Kelly Wells, address that issue for me. Normal chest x-ray. And so just kind of focus on this, because remember, this is a respiratory problem. It becomes a breathing issue, which was seen initially clinically. This person clearly does not have a normal chest x-ray. This is someone with a pneumonia, fever, cough, shortness of breath This is the person that is not going home, but is being admitted to the hospital. Shortness of breath, and so you can see someone like this is pretty close to going into the ICU and most likely is going to have to be intubated. And this is what we're trying to avoid: ICU admissions and intubations for those individuals with comorbidity issues and those of us who are 65 and older. This is a major concern because many of these patients are not able to be extubated once this process takes place. And so they don't leave the hospital alive. And this is my last slide for you. The goal, flattening the curve. So for the first 9 months, we had just primarily wearing a mask, hand washing, social distancing. We're trying to shift this red into the blue. And so now we have 3 additional ways of trying to address this. And these are the vaccines that my colleagues again will discuss with you. But we still have a ways to go. You may hear some conversation about herd immunity, but we probably, hopefully by the summer, we can see less red here and a lot more blue in terms of our population in our society. So Jake, that's my introduction to our audience. And then I will turn this back over to you and I will stop my share.
Thank you very much, Dr. Cody. That was very informative. We have some questions that we want to introduce. Let me do a little housekeeping here. Senior Vice Poll, are there any questions in the chat that we want to address first?
Right now, we have no questions in the chat.
Okay, we'll move on. I'm going to have some questions that came in earlier. So those that are in the audience, this may be some questions that may be on your mind as well. So, and I'm going to just pick some panelists to answer these questions kind of randomly. So enjoy. The first question: what are monoclonal antibodies and why is it not being talked about as a treatment? Dr. Spates, can you address that, please?
Yes, that's a very good question. Monoclonal antibodies, they're proteins that are made in the lab, and they pretty much mimic the body's immune system and how it responds when pathogens or viruses are entered into our bodies. And so right now, there are a pair of monoclonal antibodies that are available to treat COVID-19. However, it is for those who have mild to moderate symptoms associated with COVID, and you have to meet certain criteria. So there's a list of criteria that you have to meet in order to be eligible to receive a monoclonal antibody. And it's pretty much high risk. So if they feel like you're at high risk for developing severe COVID and you have other comorbidities, then you may be a candidate. So talking about monoclonal antibodies with your physician will be a great idea if you have mild to moderate symptoms. So again, I think understanding that it is available and understanding how it works, and also that it is available to you, but you just have to talk to your primary care physician to get approval to receive it from a facility.
Okay, great.
So you have a question in the chat room that I would be glad to address with your permission.
Okay. Yes, sir, please do.
All right, so this is a question that directed to me about COVID-19 being zoonotic. Is it possible to get COVID-19 from a pet? And the thought is that that is very, very possible. And in fact, when you are home and you're quarantining, it is advised that you not only stay away from your family members, but to avoid interacting with your pets as well. So yes, that's an excellent question.
That was a great question. Thank you, Dr. Cody. Next question. What would you say to someone who say that they are afraid of getting the vaccine? Dr. Wells, can you address that?
Sure. First of all, I would acknowledge that that is not uncommon, unusual, or something that anyone should be ashamed of. I think that what we're beginning to hear about concerns about vaccine is rooted in either misinformation or the fact that many of us in the Black community especially have suffered at the ill treatment at the hands of members of the medical profession, as well as, things that functioned, at the behest of, a public health system that really has failed people of color for years. So, that fear and concern, I think, comes from a place that we all can understand and acknowledge. That said, I think that when fear is rooted in misinformation, we all have a responsibility to support people to ensure that they have access to correct information. So the more you know, I think the better able you are to make an informed decision. But I think, the irrational fears that sometimes result from not having a clear understanding of what there is to be afraid of is something we can work to correct. I'd also say that what is to fear is COVID-19 and its impact on our communities. Data has shown us month over month, and it has been demonstrated and duplicated, not just in our local community, but across our state and nation, that the communities that have suffered the most impact and loss because of COVID-19, those hospitalizations and intensive care unit admissions that Dr. Cody spoke about, are our own communities. And so I feel a responsibility, as I'm sure all of my colleagues do, to make certain that our fear doesn't paralyze us and keep us, help us remain vulnerable to the real foe, which is COVID and the disease. All of us, I think, have either had personal experience, so personal loss ourselves, or knowledge of folks who have lost not one, not two, not three, but even more than that number of people to death as a result of this. So, this is the tool in our toolbox, along with our behavior change, that has the ability to restore our communities and prevent us from remaining the community that is suffering the greatest amount of impact from this disease.
Absolutely. Yeah, fear the virus, not the vaccine. Absolutely. Thank you. I have a question that came in. I'm sorry. Do you want to come in?
Yeah, we have a question in the chat.
Okay.
The question is, are there any known long-term effects of the COVID vaccine?
I
Let's
can answer that one.
Yes, thank you.
So in terms of long-term effects of the vaccine, that is a good question. And I think that is one that really concerns most people. What are the long-term effects? But to be totally transparent, we don't know. We don't think there are long-term side effects, just similar to our other vaccines that are currently on the market right now, the influenza and other vaccines. We really don't see long-term effects from those. Mainly what you get are the short-term adverse effects that you see are the myalgias, the headaches. Sometimes you may see fever and those types of side effects. But in terms of long-term, right now, there hasn't been enough time to collect that amount of data to look that far out. But it is unlikely that there will be any long-term effects as we see with other vaccinations.
Right.
I would like to
Thank
add
you.
another thing to that. If you
Yes.
think back statistically, this time last year, the state of Washington, we had a total of 6 deaths in this country related to the COVID. And here we are now, exactly 1 year later, and we've got over 500,000 deaths. So the worst thing that we can do in this society is to do nothing. I know of a nursing home here where there are 140 employees and only 48 of the employees took the vaccine. So we've got a lot of work to do. And what we're doing tonight, if we could just get one person to change their views or overcome their fears or myths, we may save someone's life.
Amen. Okay. There was another question that came in earlier a patient is on Ozempic, a insulin, are there any conflicts or any problems with taking Ozempic and the vaccine? Dr. Cody? Or yes, Dr. Cody?
No, I am not aware of any conflicts. And in fact, I know of patients who are using Ozempic and have already received the vaccine, and they have had no complications. And remember what we said in the introduction, the comorbidity issues. So to go into the hospital, into an ICU, and to have your care further complicated by diabetes makes your situation very negative.
Okay, thank you. Dr. Wells, I'd like for you to answer these next two questions, please. What is the impact of not getting the COVID vaccine? First question. And I'll let you answer that, and then I'll have the second question for you.
So, I think there's a personal risk that we have to acknowledge. Certainly in my mind, putting my family doc hat on, a decision not to be vaccinated is a decision to remain vulnerable to disease. That's the decision, right? So you are not having the vaccine. You are in fact choosing to remain vulnerable to this infection. So I think there's the personal risk that goes along with that. I think that the new piece of information that we have that we hoped we would find to be true, but is actually now becoming something that we are aware of, is that when you are vaccinated, if you're exposed to the virus that causes COVID-19, you actually don't carry as much of the virus in your nasal passages, and so your ability to transmit the virus once exposed is decreased as well. We weren't certain that was going to be the case, and we're really interested primarily in protecting the vaccine recipient. But now we find that vaccinated people actually circulate less virus, and so you actually can protect others in your circle, in your community, by yourself being vaccinated, and that's an important thing. I think we can't neglect the idea that we ourselves, as we work to inform ourselves about this illness and learn more about the vaccine, we ourselves become resources in our own communities, in our own circle of friends, right? I like to use the term force multipliers, right? So those of us who are able to get the right information and can understand it and then accept a vaccine ourselves, we then serve as a resource for and a source of reassurance for those who may be reluctant. So a choice to remain unvaccinated, if you are a patient care technician at a local nursing home, or you are a nurse or an LPN in a healthcare setting, you sharing with others that you have chosen to remain vulnerable to disease actually can have a negative impact on those who are looking to you as the resource. So I think our decisions to be vaccinated when eligible is actually one of the big ways that we can communicate to our friends, our family members, our church members, our neighbors, that this in fact is something that is safe and is the right choice to make for people.
Great. And so, that ties right in with the next question that came in is, some people say they're going to wait to get the vaccine. What would you say to them? I think you pretty much answered that. Yeah.
Or, there's some things you can wait on. There are some things that will come across our paths that it's okay to take a wait and see attitude. I am one of those folks that balances risk versus benefits. And, as I said, I think the loss is so great in our communities, and we have enough information now about the vaccines that are available on our market to be able to confidently say that this is the appropriate next step to protect our communities. I think also, and I don't hear this enough, but we really should be a bit, outraged that the access to communities of color was limited to some extent to start with. Something that's impacting us the way it is, then I think we should really have advocated as a community of people to have access to the solution. Because if you watch it, we're tracking it, in fact, the communities that are minority communities are lagging significantly both in access to vaccine and acceptance of it. But those with means and those who are non-minorities are crossing county lines, sometimes even state lines, and gaining access to vaccine. We have a responsibility to each other and to ourselves to be sure that we step up and make sure that our communities are covered.
Yes, indeed, indeed. Yeah, I heard of there was, like you said, they were crossing the lines just to get the vaccine when it's right there in their community. So, yes, thank you. There was Vice Poll, Senior Vice Poll, I think there was a question in the chat.
Yep, we have another question. Were there any Black researchers involved in the development of any of the vaccines?
Dr. Spates, you want to answer that? Or does anybody know that answer that question?
To my knowledge, yes. I think the main investigator was an African-American female, and right now her name is, I'm drawing a blank on her name, but she was one of the lead investigators. Dr. Wells, do you recall, or Dr. Mills?
I think it's Dr. Corbett's her name,
Yes.
I think.
Yes.
Yeah.
Okay,
Correct.
okay.
Yeah.
She was actually the senior research physician, the senior research PhD working in Fauci's lab.
Exactly.
Okay. Okay, great.
Mr. Williams,
Yes.
I just wanted to just piggyback on what Dr. Wells said as more of a testimony, because I think she hit the nail on the head when she said we can all serve as role models for our family and our friends. Because when I got my vaccine, my mother was adamant that she was not getting it. She was one of those, theorists that believe that the government is involved and no, I do not want to get this. And once my husband and I got it, and she saw how well we did, we had no problems. We did have some arm soreness, but other than that, we survived.
Right.
And about 2 weeks later, she called me and said, I think I want to get the vaccine. And that in itself does speak volumes. When we step out and do it and others see that, they will follow.
Yes, yes, indeed. That is great testimony. Yes, we are leaders in the community and people do look up to us, and we should lead the pack. Great, thank you. I'm going to go to another question. And Jocelyn, Dr. Spates, please take this question. Are you satisfied with the data given on the effectiveness of the vaccines and their Pfizer, Moderna, and Janssen? And what are the differences?
So, there are 3 vaccines, as Mr. Williams has mentioned. Obviously, we have the J&J or Janssen, we have Pfizer, and we have Moderna. The J&J, which is the most recent one, is a 1-dose regimen. So a lot of people are, wanting to get that one so they don't have to go back and get another dose. It is effective. It is refrigerated and not frozen like the other 2 products. And it does prevent severe disease in about 86% of the time. And then in the Pfizer, about 95% prevention of COVID-19. And with the Moderna, it's about 94% prevention of COVID. And now what I do want to say is the 2 doses with the Pfizer is separated by 21 days. Moderna is separated by 28 days. So you do have to go back and get a second dose. What we did see with the J&J is that there was less myalgia, less headache, less body aches and things of that nature with the J&J. So that is something that also, bodes well with a lot of people when you have less of the side effects, as well as injection site pain. I did want to mention that because that is something that is prevalent with the Pfizer as well as Moderna. And that is something that I experienced when I did get my vaccine. There was an injection site pain and myalgias associated with it. But all 3 products are effective against COVID. And really, if you're offered one of them, it's going to protect you against COVID. Now, will it keep you from getting COVID? And that's the one thing I think we need to be clear about. You may still get COVID. And I often think about, the influenza. with the flu vaccine. You can get the flu vaccine, but you still may get the flu, but it won't be as bad. So you won't end up hospitalized. You should not end up hospitalized and on a ventilator, but you still may have some mild symptoms. But again, it's not 100% effective. So I do want to make that clear, but getting the vaccine is protection.
Awesome. That's true. That's a great point to point out, that you won't die if you at least get the vaccine. You'll be a lot more covered, protected. So thank you.
So
I think there was a question in the chat. Yes, sir, Dr. Cody.
There's a question on here that I would like to address, and I would invite my colleagues' comments as well. I think that Wes and I have talked about this once previously. It asked the question, besides the obvious concerns of worry or anxiety when a person contacts COVID, have you heard of any other psychological or emotional effects on COVID? And so Dr. Mills and I addressed this very topic maybe about a month ago. There's been a significant increase in domestic violence within families, and the increase in alcoholism, or increased consumption of alcohol in homes. And one of the things that we showed is when small children, and we had a male kid on there about 5 or 6 years of age who witnessed physical harm taking place in his family, that child will probably be at greater risk of being an abuser himself as a teenager or an adult male. So those are two classic things that are on the radar right now with this entire COVID environment that we're living in.
Great point. You're right. The psychological effect, even if you don't receive COVID, just being isolated is really, has been on the rise. People feel like they're losing their mind. They've got to get out. So that's a great point.
Can I add something to that?
Yes, please.
So, I love that we've called attention to something that I don't think many in our community especially are talking about at all, right? The impact of all of the change that being in a pandemic has had on us, right? And those scars are to be borne by, by our society, by our family units, by our physicians and clinicians who will be caring for folks who, will manifest things related to this for years to come. The other thing I think it's important to recognize is that there is some concern that COVID infection itself, that the illness itself, carries with it some neurologic and perhaps behavioral health impacts. Folks describe it as a brain fog, is one of the more common sets of symptoms. And it has to do with, just a loss of clear thinking. For most folks, it's temporary, it's short-lived, and it resolves as the infection itself resolves. But, as we are finding with some other symptoms related to COVID, for some folks, it actually hangs on quite a while. There are folks who long after their COVID infection have debilitating headaches, or have short-term memory loss. And so we can't lose sight of the physical and mental impacts of COVID directly related to infection. And in my mind, that's another reason that, you don't want to be exposed to this, because you don't know what your experience will be. And worst case scenario, you won't have mild cold symptoms that resolve after a few weeks. You may be dealing with this for weeks, months, or possibly years to come.
Great. Yes, absolutely. Other effects from COVID, not
Jay,
just
can I just
physical.
piggyback on what I just want to
Yes.
piggyback on what Dr. Wells said, and that's one of the things that I try to tell my patients and family and friends, because when you get infected, this is very unpredictable because you don't really know how you're going to respond. We'll see very, very healthy people who you would think would do very, very well end up being hospitalized. Now, this doesn't happen all the time, and most of these people have other underlying conditions, but it does happen. Or you'll see some people who you thought would do poorly end up doing well. It's just very unpredictable. You don't know who's going to, we know who's at higher risk, but we don't always know who's going to do very poorly, who's going to do well. And then again, we don't know who's going to have these long-term side effects or sequelae. So it's, that's why we try to say, if you can avoid getting COVID, please do, because there's, why even take the risk?
Right. So Dr. Mills, let me segue into a question for you, and then Senior Vice Pole, I'll get you with that chat. But is it better to get natural, or they call herd immunity, to COVID-19 rather than immunity from the vaccine?
Well, let me just start off by kind of explaining what herd immunity is. So basically, it's when you get indirect, immunity, which we can get from certain infectious diseases. From basically, if a certain percentage of a population is immune, whether that be from past infection or vaccination, then because there's not as much of the virus running around, the people who who aren't currently immune may not get the disease. The problem is they tried this with COVID in Sweden, and that did not work very well. It was disastrous. It did not work well at all, because they thought they would get about 40% of the people will get infected and develop this, and it ended up being like, I think the number was like 10%, and they had one of the highest number of deaths per capita of any country. So it did not work. It didn't work very well. The problem with, we definitely want people to get herd immunity. And we talk about, and I hear people talk about Dr. Fauci, and I watch CNN all the time, and they're talking about it. And we think we may get it by late summer, early fall, and maybe it gets faster the more people get vaccinated. The problem with it, so you can get it both two ways, from vaccination or from prior illness. Obviously, we would like you to get it from vaccination, because we think, even though we don't know how long your immunity lasts from the vaccination, we know it's much longer, or most likely much longer, than from prior infection, which we think maybe 3 months, and maybe longer, but we think at least 3 months. So that's one of the things. So we really just would like people to get vaccinated, because we think that really is going to go towards helping us reach herd immunity, but because it's, the vaccination just seem to last longer versus just being, infected naturally. And the problem is, like we said, once you've been infected from it naturally, we don't know. I mean, there's obviously, you can get reinfected, because if your immunity only lasts 3 months or a little bit longer, COVID, unlike the flu, is not seasonal. So, you could obviously be reinfected, which obviously which is a major problem. So.
Awesome, great. So get the vaccine. Don't wait for herd immunity, the natural herd immunity. Senior Vice Pole, there was a question in the chat.
Yeah, we actually have a few questions. We have some questions coming in. So Dr. Watkins is going to help me with them. So I'm going to take the first one. The first one says, and it's funny because I hear people say this quite often. How would you counsel the patient who says they are waiting on a word from the Lord to tell them whether they should get the vaccine or not?
So my response to that, when a patient would present me with that comment, is that God made doctors to help people with those kinds of issues. And I say that very seriously. And like Dr. Wells said earlier, I respect what that person is saying. And I would never say or do anything to belittle them, but I do try to get them to change their minds. As you know, from our society, the worst wars on the planet Earth have been religious wars. And trying to get someone to change their religious views is very difficult to do. And so my parting statement would be, I would want you to get it. I have received it myself. If you change your mind, please feel free to come.
Yeah, I think we talked about one of the vaccines. The Catholic Society is kind of against that. Then we discussed that was the J&J vaccine. They had a problem with that. Yeah,
they did have a problem with some of the research with cells from fetuses, aborted fetuses. Yeah, and so, that topic is not going to be resolved tonight with anything that we have to say. So they do have other options. That's the adenovirus with the J&J. So if someone brings that up, just advise them to get the Moderna or the Pfizer.
Okay.
If I could add a couple of things. One of the reasons that partnerships and collaborations and conversations are important is because There are a lot of levers we can pull to kind of, help folks get to the decision that's best for them ultimately. And so, partnerships that we have in the clinical community with the faith community, for example, are ways that we can advance some of these conversations. When you see groups of faith leaders across disciplines, across the state, coming together to align themselves around this concept of, get the vaccine so that our communities can remain intact, I think that's a really powerful message that, might help an individual who is waiting for a sign from the Lord to shift. The other thing that I think, we haven't done as a clinical community as well as we could have, and now we just, we can no longer avoid uncomfortable conversations. There's some things that are rooted in sort of a tiny bit of fact, but they get perpetuated, they get blown out of proportion, right? And that's what has happened with this, fetal tissue cell line issue. These are not, there are rules and regulations around use of fetal tissue that have been in place for decades. And so when we talk about how vaccines are developed or even other drugs, it's not uncommon to test drugs against cells or in cells to determine, that's sort of the first safety test. Does it do what we think it is going to do? And does it have some sort of cell impact that we're worried about? The cell lines that's very different than fetal tissue, fetal cells, right? These cells have been kept alive in laboratories for years, for decades. It's not unlike Henrietta Lacks, right? Okay. It's the exact same thing. What we've got to do as a clinical community is be able to step up and say, you know what, that's not exactly true. I know where that started, but let me tell you the truth around that. Because I think armed with the truth, folks will be like, oh yeah, okay, I understand that. And even the Catholic Church said, if you're at significant risk of COVID, take the vaccine that's available to you.
That's right. Very good. Thank you. Next question.
Yeah,
for the Watkins.
Yeah, absolutely. So this one is one that I think a lot of people in the younger community may ask. And so I don't get the flu shot. I'm not overweight or obese. My immune system is good. And COVID-19 has been here for over a year now. And thanks to God, I'm blessed to have not contracted COVID. So what is my reason to get the vaccine?
Yeah, I think like we said before, the problem is, so, when we were talking about this before, so say you are really healthy and you get it and you become an asymptomatic carrier and then you spread it to and you don't even know you had it. So you don't get tested because you don't feel ill. And then you give that to your grandmother or your grandfather or anyone in your family who may have some of these other comorbidities, some illness, diabetes, hypertension, someone who's, undergoing treatment for cancer, and they end up being hospitalized or die. How would you feel about that? I mean, you would feel horrible. But on top of that, like I said, just because you're young and healthy and you don't get the flu shot, and you've never had the flu, does not necessarily mean that you will not have problems with COVID. I mean, this is very unpredictable. So it's not just like, just because you're young and healthy that you won't have problems. So again, I just tell people, why even take that risk? I mean, I was one of the first in line to get, the COVID vaccine. And I think I'm pretty healthy. I work out daily, I run and all these things. But I didn't want to take that risk because it just seems like, why take this risk if it's not necessary? And, on top of that, like I said, part of it is, we're trying to, be our brother's keeper and our sister's keeper. You want to watch out for your, your family members, your friends, but also just for your own health. Why even take that risk?
Yes, absolutely. Any more questions in the chat? Okay. The next question, Dr. Spates, what is the difference between emergency use authorization versus normal approval of a vaccine?
So emergency use authorization is pretty much, it facilitates the availability of medications during a pandemic, which is exactly what we're in right now. So that doesn't mean that steps were skipped. Typically, drugs go through phases. So you start with, your preclinical trials, then you have phase 1, phase 2, and phase 3. So all of these vaccines have gone through those phases. However, the third phase it's what has been sped up a little bit more so on the traditional track. Normally it takes about 5 to 10 years for a product to come to market. In this case, we were in a pandemic, so we had to push this product quickly. Steps were not skipped. Once we determined that the products were effective and safe, they were pushed out to market. And it was tested in a variety of populations, including minority populations, Caucasians, as well as Asian Americans and Native Americans. So it was tested in a variety of populations. So we have confidence that the data that we have been presented is true and is accurate. Although it did not take 10 years to get to that point. We had to act, and we had to act quickly. So that is the reason why we have that emergency use authorization on all 3 products at this time.
Great. Yeah, a lot of people they're afraid of the vaccine because they think it was rushed through. And so, yeah, but thank you for clearing that up, that no steps were missed. They just did it a little faster, but all the steps were taken to make sure that it is safe and effective.
Jay, could I add a couple of things to that as well?
Yes,
Dr.
please do.
Spates said, because we hear this all the time. I think in addition, a couple other things were in play. First of all, a lot of resources, basically it was all hands on deck, first of all. So, because that doesn't normally happen. So first, all hands were on deck. It was a pandemic. So, all the resources were given to, the companies to do this from a financial standpoint, from a talent standpoint, which also helped with all of this. We had a lot more participants because it takes a long time for some of these times because we don't have enough participants in the studies to get these things done. So sometimes these are, it takes a lot longer. You don't have the financial resources because vaccines typically don't make a lot of money. So with the government backing, that helped a lot. So there's multiple reasons why sometimes these, medications and different drugs take a long time to come to market. And the government kind of helps with this. The government, because again, we're in a pandemic, so these are different times. So just want to add that in.
Awesome, great, thank you.
Jake.
Yes, sir.
I'd like to change the model up here for just a bit. I see the name Bunyan on here, and that was the question about the physical fitness and not taking the flu shot. But I'd like to hear his view on that. And because we've been able to change a few people's minds with the dialogues we've had. But I'd like to hear him have a bit of conversation with Wes, because Wes is in great physical condition, probably better than most of us on this call. But Mr. Bunyan, would you turn your camera on and give us some feedback, please?
How you doing, brother?
Yes.
How you doing? Yes. I don't get the flu shot. I'm, fairly healthy. I'm work out daily. And I just don't, first of all, y'all said it. I really don't trust the government, number one. And I don't see, and y'all just hit it again. I thought it was rushed through. AIDS has been here for years. There's no cure for AIDS, but all of a sudden they can cure COVID. There's a vaccine for COVID. So it was a lot of, speculation I had. But again, I'm the only one in my household who does not, don't trust. My wife she has the vaccine. My in-laws have the vaccine. Me personally, I'm just waiting. I'm not in a rush because I am healthy. I want the people who were obese, other health conditions, other underlying conditions, I want them to go ahead and get it first. Again, I'm at this moment, I am considering getting it, maybe sometime this summer, but I'm still not in a rush. I go to work, I come home. I'm not around a lot of people. I'm family. I'm not hanging out. I'm not doing traveling. So I'm really not in a rush. So, but I'm just trying to do my own study. I'm trying to do because I don't trust a lot of what CNN says. I don't trust it. So I listen to you guys. I listen to my in-laws, a little more educated than me. And I just, try to make the best educated guess. I pray about it, and like you said, when the Lord tells me, Tony, go ahead and get it, and I think he's reckoning on me because, I'm on this call right now, so I'm just being patient, good brother.
Okay.
You know what I mean?
Yeah. Okay.
Thanks for being on the call.
Yes, sir.
Yeah.
Thank you.
All right.
Brother Bunyan, I would just say, this is, I tell everybody, you know, we always talk about, like, you know, and I had 3 or 4 patients a day, because I really bring this up with almost all my patients. And they would say, you know, I don't ever get the flu shot. But COVID is not the flu. It's not influenza. First of all, it's more contagious. You know, in a bad year, you guys can chime in. I don't know how many people, 30, 40,000 people, 50,000, 60,000 people may die from influenza. We've over 500,000 people. This is not the flu.
Yeah.
And the part of the reason I'm saying this, Brother Bunny, is because, again, you could, because you do work, so you're around other people. And I know we say, you know, avoid long conversations and long interactions, but you could just have a chance interaction with somebody and still contract COVID. You could still pick it up. So nothing's foolproof. The masks aren't foolproof. Anytime you're around someone, you know, in close proximity, you still are at risk. Now, maybe lower if they have, you know, distance, 6 feet, masks on, all that stuff helps. But, you know, nothing's foolproof unless you're running around with an N95 mask, it's been fit tested and all that kind of stuff. You know, there's still a chance. I would just say, just be careful, you know, and just definitely, you know, when you have questions or concerns, and I understand that, you know, not basically trusting the government, especially, you know, with some of the things that have been happening in the last few years. But I would say, if you have questions and concerns, you know, I know your mother-in-law is a pharmacist, and, you know, or, you know, hit me up, or anyone, you know, any of us that, you know, you have questions with, because, you know, we wouldn't even, first of all, we wouldn't be getting the vaccine if we didn't think it was safe for ourselves.
Right.
You know, we wouldn't want our family to get it. You know, I wanted my mother to get it because, like I said, I'm healthy. So I'm kind of like you, but I thought it didn't make any sense for me to have that risk, or to worry about me possibly spreading to someone else. Because, Tony, you could get it and have no symptoms whatsoever, buddy. You could be completely asymptomatic. And because you're asymptomatic, unless you're getting regularly tested, you would not know you even had it, which means you could be spreading it unknowns to yourself to other people. And you wouldn't even have any idea. And if you spread that to someone else who is, you know, who's immunocompromised, maybe suffering from, you know, undergoing cancer treatment or anything else, they have an autoimmune disorder, and they could have horrible outcomes. And you wouldn't even know that you gave it to them, because you never, you know, you hadn't been tested because you didn't feel sick. So I would say, at least keep doing your research, keep talking to people, keep praying about it. If you have any other questions, concerns, you know, get with us, because I think the more you know about it, the more comfortable you'll feel about it. And, that's it. So not lecturing you, but just keep thinking about it.
Yeah. I have been tested over about 6 times. You know, I get tested probably once every 6 weeks, because I do work, and I work around kids. But again, you know, I'm negative. And I told my wife, you know, right before COVID hit, and last year, 2019, 2020, my wife and I had just came back from Hawaii, and we flew in Seattle. We stayed in Seattle for hours. And when we got back home to Jacksonville, the next day I got sick. I went and that whole for weeks I was sick, and I had never felt that type. It felt like flu. So I told my wife I may have already had COVID, and, you know, my immune system just was able to fight through it, because I didn't go to the doctor, because at that moment COVID wasn't prevalent. Even though it was here, the president didn't make us aware of it, but it was here, but we didn't know it. But when it did shut down, I had already recovered. And, you know, so at that moment I'm like, well, you know, I'm good now. My wife, she was sick. You know, she recovered. Not saying it was COVID. We didn't get tested. We just know it was something that we had never had, because my body felt different. You know what I mean? Like I don't get that sick. I rarely get sick. So, but again, I thank you guys for the information, and thank you guys for hosting this call, because it's great information. And again, I am considering sometime this summer, or, you know, maybe sooner. But I just want to, you know, do my research. But thank you guys again for all this knowledge. Thank you.
Awesome. Great. Okay, in the interest of time, it is 8 o'clock, so we'll keep the questions open for another 5 minutes, and then we're going to wrap this up. There are another couple of questions that we have, and
yeah. So does anybody want to address the comment that's in the chat here? It says researchers have been working on other COVID strains for years. They simply needed to redirect their efforts to this particular variant.
Unmute Dr. Spates.
I was just saying, I was just concurring with that. I think they were just making a statement, right? That's what I gathered from that.
And I
'Cause
think
we hear
may
that a
have been
lot too.
Yeah.
Yeah, we heard a lot about the mRNA vaccines that, that it's brand new and no one, and so we know there's some of this technology has been out there, just was redirected towards COVID. And I think that helps people a little bit feel a little bit better about it.
Okay.
Yes.
There's another.
I would just clarify that remember, COVID is the disease, right? Coronavirus is the family of viruses, right? That's where MERS and SARS and other viruses that don't cause such severe disease. So I want to be sure that we straighten our terminology so that we're super clear. I haven't been working on this particular illness because it was just identified, but the family of viruses has been the subject of research for some period of time. And mRNA technology has been in use for decades. One, because they were looking at it for a potential Ebola vaccine, but it's also utilized in cancer treatments. So not new technology, right? New to this particular realm, which I think should be reassuring to people.
Any other questions in the chat? We're gonna leave it. We're gonna talk another couple minutes. I do have another question here.
I'm sorry, Dr. Williams. I was on mute. I was reading. I thought you walked in.
Okay. No, go ahead.
Do the people that don't trust the vaccine know that the same organization that approves the everyday meds that they take when they fill a prescription or buy over-the-counter medications that they buy?
So I love that statement. What I've said more than once is, we don't question the vaccines our kids get for school entry. We don't question the shingles vaccine and other tetanus and things that we have to get as adults. So it's interesting in this setting, because these things are being developed literally under a microscope, that we have the opportunity to learn about how vaccines are developed. Well, how do we know it's safe? Like, what's in place? Like, we can now question the powers that be and thought leaders in this area in a way we never thought to. We're giving, much more thought to this than some of the things that we know to be of harm to us that we accept into our bodies. So, I think it's really, it's an interesting dynamic. All of us are learning about viruses and that sort of thing. I think prior to now, it's like, I need what to go where? Okay. What time do I need to be there? We have the luxury now to really learn about this in a way that has not been available to most people before.
Jake, I just want to piggyback on what Dr. Wells said. I have the same conversation with patients all the time that, no one really, we take medications all the time and people don't truly know how long it takes for them to be developed. We take herbal medications all the time, which aren't even regulated by the FDA. We won't get into what other people take that no one's even regulating. That's a whole, that we won't get into that conversation. But, there's so many things that people take that is under no regulation that no one knows what's going on.
Makes them feel good. That's why.
Right. Hey. But we won't get into that. But yeah, so I understand people's trepidation and their concern, but it's just funny to me not funny, but it's just when we look at things that, how many things we take and we have no idea how long, new medications come out all the time and we truly have no idea like how long it took for this to be developed or that. I guess because, like Dr. Wells said, it's because this is under such a huge microscope that we see everything. And so it's so concerning.
What I'd like to suggest to everyone on the call tonight, if you get about 20 minutes of time, go to YouTube and look at the history of the Spanish flu from 1918. On the planet Earth, we lost 50 million people due to the Spanish flu. And I think that part of this emergency utilization authorization is because those that are knowledgeable and understand the true impact of this virus, if we do nothing or if we continue to wait, do we really want to see those kinds of numbers again? I don't think we'll see 50 million, but you think in terms of the United States, we went from 6 deaths in the state of Washington to 500,000 in almost a year. And if we don't do something, it would just be an exponential growth in people dying.
A question for you, Dr. Cody, and this came across a couple times. Can a vaccine affect fertility?
So my answer to that is no.
Okay.
And I think it's a fair question. And certainly anyone who's struggled with trying to have a trial, patients who've gone through miscarriages, it is so difficult to get those patients to take any kind of medication because of all of their fears. And so I always respect someone's fear of a medication and try to continue to reassure them as best I can. If they ask me a question that I don't know the answer to, I'll say I don't know the answer. I'll look it up and get back with you. But that one, Jake, I know the answer to, and the answer is no.
Yes, thank you. Yeah, it's a big question that's been coming across. Any more questions in the chat? Okay, we're gonna take two more questions, and then we're gonna close out. Dr. Spates, can you speak about the people who participated in the vaccine?
Yes,
The
so
different types of people?
a lot of concern obviously were minorities included in the clinical trials? And the answer to that is yes. So there were about 70% Caucasian in the Pfizer as well as the Moderna and the J&J. For the African Americans, there were about 10% in the Pfizer and in the Moderna clinical trials. Only about 5% in the J&J to date. They are still in phase 3, and they have not, and the J&J have not published their data. So likely their percentage will go up as well, but about 10%. Typically, African Americans in clinical trials represent about 5%. So this is more than what we typically see. So we were represented in those trials.
Right, yes. So Black folks, yes, please don't be afraid. You are represented. Last question. Dr. Mills, what are the inherent dangers to patients if their healthcare provider does not get vaccinated?
It basically would be the same if you're around anyone who's not vaccinated. I mean, there's always a risk of transmission. Hopefully, the majority of our healthcare providers are being vaccinated. I know there's some who, are a little wary about doing it, but the majority of us have been vaccinated, are promoting people to get vaccinated. But like I said, whether you're at your doctor's office or you're at a family gathering, if you're around people who have not been vaccinated, there's a risk of transmission. Now, if they were sick, obviously the main thing, and we talked about this a lot, is there always risk mitigation. Make sure you're keeping, 6 feet apart, mask when able. Obviously, when you're at your doctor's office, they're doing exams, but those typically are, limited to a short period of time. So it's not a prolonged interaction as far as the exam. Now you're in the room for quite a bit of time. So that would be the issue. But again, hopefully the majority of our healthcare providers are, being vaccinated, so that won't be an issue. But if I guess you could directly ask your healthcare provider if they've been vaccinated. And that would be a fair question. And obviously they should be doing the universal precautions regardless in the office. Any panelists, you got any thing to add on?
Okay. Well, I don't know about anyone else, but I learned a lot tonight. And I am so thankful to have the panelists. I want to thank Dr. William Cody, Dr. Jocelyn Spates, Dr. Kelly Tice-Wells, and Dr. Wesley Mills again for their unmatched knowledge in this COVID-19 vaccine at this time. And I want to thank all the committee members also again. And most of all, thank you to everyone that joined us. And be looking out for our town halls again. This is the Kappa Psi Health and Wellness Committee town hall, and we're going to have more throughout the year. And we hope that you'll join us. Thank you. God bless you. Stay safe and good night.